We have seen a significant drop in new COVID-19 cases across the country. Several states are beginning to ease restrictions, all in an effort to return to pre-pandemic normalcy. Emory University's Dr. Winawer joins us live with more on this. Good to see you, Dr. Winawer. Good morning.
Good morning, Elise.
Okay, so what are the current case numbers and what percentage of the country does the CDC still recommend universal masking?
We're averaging about 35,000 cases a day, which is dramatically down from over 800,000. But still, it's significantly high when you look at the history of the pandemic, but really coming down. Deaths are coming down as well, still very high, over 1,000 a day. Hospitalizations are down as well. But the good news is less than 2% of the country now has to wear a mask, and socially distance is considered high risk by the CDC. Over 75% is low risk, and then in the middle, over 20% is moderate risk, where you really need to individualize whether you wear a mask or not based on your own health status and those around you.
So, Dr. Winawer, as the Omicron variant really is starting to subside, should we be keeping an eye on the more transmissible BA2 variant?
To some extent, it's not going to cause a spike, I don't think, but it might slow the rate of decline. Our vaccines are very effective against this new variant in terms of severity of infection. And a big thing is those who have gotten the original Omicron variant, the BA1, it's protective against this variant as well. So when you combine vaccination and immunity via infection, we're protected, and then also it doesn't cause more severe illness. And when you combine that with more robust testing and treating, I think we're in good shape. I think it may slow decline, but I think all in all, it's not something to overly worry about. It will become the dominant strain probably in weeks to months, but I think overall the rates are still going to go down.
Okay. So last week, Dr. Winawer, the Biden administration launched a nationwide test to treat initiative so that really Americans can rapidly access help needed for COVID-19 treatment. So can you describe for us how that will work?
Yeah, this is going to be like one-stop shopping, particularly for those who don't have a primary care physician. If you have a primary care physician and you test positive, of course, you can contact that person. But this is done to try to make it easier. They're going to put these test and treat facilities incorporate them within the major pharmacies, Walmart, CVS, Walgreens. And essentially, if you test positive at home or in the pharmacy, you'll have access to a provider, either a physician's assistant, a nurse practitioner, or a doctor. The pharmacist is not able to prescribe oral medication, but one of those three providers can, and they'll make an assessment based on a lot of factors: your vaccination status, how severe your illness is, and other things. And then if you qualify, they'll give you an oral medication, typically Paxlovid, which is Pfizer's drug, or Molnupiravir, Merck's. But Paxlovid seems to be more effective, 90% protection against severe illness. So this is really going to be, I think, convenient. And I don't think you will be charged for it either. It will be free of charge. So this is really going to be helpful. One caveat to remember, too, is that these drugs work best if given within 5 days of infection. So you shouldn't wait on your symptoms. Get yourself tested. And if you are positive, then come to one of these centers where you could be assessed for treatment. And if you qualify, then it's just going to it will be helpful to decrease your duration of symptoms and overall the spread in the community.
Good to know. As always, we sure do appreciate your insight, Dr. Winawer. Thank you so much. It's good to see you.
Likewise. Have a great week.
You too.